Hi guys, this is Dr. Bhupesh once again from Dr. BKM OET Institutes, trying to attempt and listening again, listening and OET listening. So when we use A, E, I, O, U, which are the vowels, we say an. But yeah, we will talk about this rule later because it is more about vowel sound. But anyhow, first of all, I would like to encourage you to subscribe this channel for the best OET videos. And today we are going to do this listening, which is of race and it's kind of an authentic OET listening. Again, Dr. BKM Institute teaches how to attempt the material and how to do OET listening. So first of all, I would like to take you along. See, when you are doing the listening, the first thing you can do about OET listening is, first of all, read the questions. Don't leave the questions. Questions are the most important part. So if I do the questions right away, Toni Davies, you will get 30 seconds. Canine, bubbles, first blank, date of visit. So over here you have to fill the age, pet's age. So they are talking about the pet. Pet displaying signs that she is. So you will discuss the signs. Recent incidents involved pitbull trying to enter dash. So they are talking about pitbull. And age you can tell. And pet displaying signs that she is something. Recent incident involved pitbull trying to enter dash. Will consider dash to prevent pregnancy. Concerned procedure would be advised about health benefits like reduction of. Never miss out the word which are prepositions of. And don't forget the models. Even will is kind of a model, though it is not a perfect model. Will, shall converts into would. So it is not like can, could, but it is nothing different as well. So talk about these things. Never forget this word to enter. Will consider dash to prevent pregnancy. So over here, there should be something like a noun. Will consider, I don't know, like if it would have been humans case, I would have thought about will consider contraceptive pills or something like that. I don't know what the topic is about, but they're talking about pets, so I think it should be about animals. So means you need to understand the topic. So canine, bubbles, then age, you have to talking about science, then talking about will consider dash to prevent pregnancy, whatever. Concerned procedure would dash. So she's concerned, the owner is concerned, procedure would dash, would do something wrong. Please expect that there would be a negative statement because concerned word is negative. So these small things make a lot of difference in your reading and listening. Try to expect these words. Advised about the health benefits like reduction of dash and dash. Advised about the negatives like dash. So over here also there would be negative things. Advised about negatives like dash and requirement to dash less and maintain dash. Okay. Owner willing to have procedures on. Now they are talking about owner. So now it is 100% pet. Obviously over here also it was 100% pet, but don't get over complacent in the exam. Complacent means don't get over satisfied. Complacent means that when you start feeling something is not important, so don't get complacent. This word is also important. Advised not to let pet dash. So there is another word advised that pet should not be let dash before the surgery. So maybe there is some advice that pet should not to let pet go outside or something before the surgery and to dash for and dash. So means try to expect what kind of topic it is. So in the exam, you will have 30 seconds, which is more than enough. Over here, obviously, we are taking more time because we want to learn from it. So by the time it will start playing and let's see how it goes. Okay. So I am putting this listening on without wasting time.
Then don't get me started about when she sees any man
Okay.
at the park, for example. Well, recently Bubbles has been acting a little bit strangely. What? She's fine overall. I just think it's
Okay. That's starting maybe from here. Let's try and concentrate. So I'm not seeing the blanks because in the exam I will get 30 seconds. I have read.
oh, she's fine overall. I just think it's time I did something about this.
What seems to be the problem?
Well, recently Bubbles has been acting a little bit strangely. When I take her to the park, for example, she'll pick fights with the other dogs just because they're, well, there. She barks so loudly. It's really embarrassing. Then don't get me started about when she sees any males about. She acts really, really, well, randy. I've had Bubbles since she was a puppy, so I know when something's up.
Remind me how old she is now?
So until now,
She's 2.
in the final exam, it will create lot of anxiety. As you can see, they have not spoken anything until now. Patients pet's age 2, or you can say 2 years old. But again, even if you will write 2, that's fine, because they are asking about age, so you will say 2, but 2 years is better. So until now, they have spoken about this. Otherwise, they have talked a lot about other things, like maybe she is displaying signs that she is. Now I can figure out that she is pregnant, maybe displaying signs that she is pregnant. Maybe now this can be answered, but let's see how it goes. Because they're talking about pregnancy or something like that. I don't know. Let's see.
And what are you suspecting?
I don't know. I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the usual signs.
So
Is Bubbles
over here, there was a word that has been spoken, which I
your
have
only pet?
missed out. So I will try to listen to it again. Okay, yeah. Okay,
Then don't get me started about when she sees any males about.
okay.
I don't know. I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the
When she is in heat or something like that.
usual
So
signs.
I don't know. This word has been spoken in very fast way, and I don't know about it, to be honest. But yeah, I can't help it. I've felt according to what I feel like. To be honest, this blank was really difficult if you don't know about this word. So I don't know about this word. Obviously, I will miss out. But in the final exam, I will get only one chance. But if you're preparing for OET, then try to listen it again and again. It will improve your listening. Let's try and listen it again. Let's see if we can find it now. Okay, let's try again. Let's see.
Right. And what
Sees any males about. She acts really, really, well, randy. I've had Bubbles since she was a pup. She's 2.
all right. And what are you suspecting?
I don't know. I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the usual signs.
Is Bubbles your only pet?
So basically, I don't know about this word, but I know the word heed somehow. But I'm putting it up again. I can't really figure it out. So it's an impossible word for me. But let's go forward. Again, in the exam, you can put it like this, whatever I have done. So let's see. Let's go further. Again, in the final exam, just forget this blank as quickly as possible and go with the flow.
She is. We were considering another, maybe a German Shepherd or a Dachshund, but I don't know if she'll be able to cope with that.
I understand your concerns.
Will she always be like this? Is there something we can do? It's getting to be a right pain. The neighbors have a pit bull, and the other day I caught him leering at her. He got pretty
Layering at her.
violent. We've got a huge hole in the fence that I'm pretty sure was down to him trying to bash his way through.
So trying to enter again. Obviously, this listening is not really cool, to be honest. But trying to enter the fence maybe can be one of the things. But again, I don't find it would be good enough because they have not talked about anything. But she was saying there was a pit bull who was trying to break through the fence or something like that has been spoken. So again, not a very good blank. So in the final exam, you don't get speaking of listening of this.
I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the usual signs.
Is Bubbles your only pet?
She is. We were considering another, maybe a German Shepherd or a Dachshund, but I don't know if she'll be able to cope with that.
So basically, she's talking about that. Do you have another pet? So she's saying we were considering another, dogs of various varieties, but I don't think so. She would be able to cope up. Why? Because she's telling about this incident.
I understand your concerns.
Will she always be like this? Is there something we can do? It's getting to be a right pain. The neighbors have a pit bull, and the other day I caught him leering at her. He got pretty violent. We've got a huge hole in the fence that I'm pretty sure was down to him trying to bash his way through.
Have you ever considered spaying Bubbles?
What's that?
Trying to enter the hole or fence, but actually the right word has not been given because the the dog was trying to enter in their house basically because there is a hole. So that dog was trying to go through the fence. So the problem is that I'm not finding the right word. So the fence is the only word I can fit in, or enter the hole. that can be the second word, but it's a difficult kind of a thing. Again, when you do these kind of listening, please don't overthink. Sometimes these listenings are premature and these kind of listenings do not come, so please don't take it. Again, keep practicing, but at the same time, don't overthink about them. Let's try to feel maximum we can. Let's see how we go further about it. Okay.
It's abdominal surgery to prevent her from becoming pregnant.
Now, thankfully, one blank is easy. We'll consider abdominal surgery. So thank God we can fill what one word, and I will make you listen again. Surgery spelling can never be wrong, so you should also not do wrong. Spellings are the worst possible way to lose your marks. Let's listen again. My spellings are wrong. Sorry, abdominally by chance due to typing it is wrong. ABDO. So yeah, let's listen to it again. Okay.
Term.
We've got a huge hole in the fence that I'm pretty sure was down to him trying to bash his way through.
Have you ever considered spaying Bubbles?
What's that?
It's abdominal surgery to prevent her from becoming pregnant. The medical term for it,
The medical term for it?
variohysterectomy, when both the ovaries and uterus are removed. She'll have
Ovarian hysterectomy. So that is what he is talking about. So let's change my word and I will try to do
neat
that.
scar on her tummy, but other than that, you won't be able to.
Ovarian hysterectomy. But again, these kind of words do not normally come. But yeah, you can practice this as much as you can. But again, this kind of listening will not come, I assure you. But yeah, but keep practicing. There is nothing wrong in practicing tough listenings. You become better. So let's go further. Yeah. Okay, let's see what she talks about the concerned procedure would.
See anything. She'll be much calmer afterwards, and you won't have to worry about annoying or messy heat cycles.
Oh, goodness, no, I wouldn't want to hurt her. Is there any other way?
Don't worry, it's a relatively painless procedure, and it's all done under anesthetic, and it's over within.
So now if you can see, I have found the word hurt. Because I had to find an active word because the dog owner is concerned that she would get hurt. So she would get hurt. Get is a better word as well. So she would get hurt is the best word I can fit in. Let's see whether it will be wrong or but that's the word I think that would be coming because now doctor is talking about that. Okay, let's go for
Hours. She'd come in, we'd give you the painkillers for her afterwards too. Plus an Elizabethan collar to stop her from interfering with the stitches. There are other health benefits too.
Really? Like what?
Well, for one thing, it'll reduce her risk of contracting breast cancer or womb
contracting breast cancer. So it will reduce the risk of breast cancer and
infection, which is something that can be fatal. Benefits too.
Really? Like what?
Well, for one thing, it'll reduce her risk of contracting breast cancer or womb infection, which is something that
or a womb infection. Now this word has been spoken very badly, very badly. Badly means obviously tough, but again, worm because that should be related to this. So that should be worm infection as far as I think. But yeah, let's see how it goes. Again, we will check the answers later on. We are again, don't be concerned about answers because you are practicing these listenings to improve. Again, we started with the motivation video. I will pause that as well. But again, see, this is an example why motivation is required to achieve any goal. Otherwise, you feel like, this is not good. Otherwise, you say, oh my God, I'm discouraged. I'm disappointed. No, you learn from this. That is what is the point. That is why motivation is the first step to achieve any goal. Let's listen to it once again.
one thing, too. Plus an Elizabethan collar to stop her from interfering with the stitches. There are other health benefits too.
Really? Like what?
Well, for one thing, it'll reduce her risk of contracting breast cancer or womb infection, which is something that can be fatal. Plus, pregnancy in dogs can be quite a big risk that can produce medical complications. The list is endless, really. I can only imagine that she creates quite a bit of mess around the house when she's in heat.
You've got that right. All of those.
She is in heat. Maybe now I would like to change the word. She is in heat. I will again like to change the word. I'm not quite sure which one is going to be correct, but this would be the final word I will do because now they have used the word again. So I'm just trying to change it. Okay.
We
complications. The list is endless, really. I can only imagine that she creates quite a bit of mess around the house when she's in heat.
You've got that right. All of those months we spent getting our house trained, and now this. Okay, I think it's something that I'd like to do. Like you say, there are lots of health benefits, and I'd like Bubbles to live a long time. Plus, I'm sure you've done this plenty of times before.
Oh, absolutely. It's a common procedure.
It sounds like there are a lot of positives, but what about the drawbacks? Will she change at all?
Her metabolism will likely slow down after she's spayed, so you'll need to feed her less and keep up or gradually increase her exercise routine.
Okay, if you think it would.
Okay. So now again, he has spoken very fast, but again, advice about negatives like decreased metabolism, requirement to exercise or maintain exercise. So these are the two words, exercise. So this is what I have heard. Let's again reconsider. But a hard
Metabolism
decision.
will
If
like-
you're doing it only one time, obviously it's a very tough list.
But what about the drawbacks? Will she change at all?
Her metabolism will likely slow down after she's spayed, so you'll need to
Like slowing down of metabolism or reduced metabolism or decreased metabolism.
feed her less and keep up or gradually increase her exercise routine.
Okay, if you think it would help. How soon could we have this done?
As soon as next week. I'll check to see if we have the space. Just make sure she hasn't had any
Requirement to dash less. I don't know what should come in. Requirement to feed less, maybe, because when there is decreased metabolism. So I'm just trying to put a guesswork. When there is any requirement of when there is any decreased metabolism, that means body is slowly absorbing the food. So I will say requirement to eat less and maintain exercise. That is the only thing I can, or feed less. So again, but not sure about it. So it would be again complete speculation or guesswork. Let's go further.
to eat beforehand. The food could react with the anesthesia
How soon could we have this done?
as soon as next week. I'll check to see if we have the space. Just make sure she hasn't had anything to eat beforehand. The food could react with the anesthesia and make her feel nauseous.
Okay, and you say it'll all be done within a couple of hours?
Yes.
Eat less before the surgery. Eat less. So eat word is coming over here as well. But yeah, pet to eat less before the surgery.
But after the. And you say it'll all.
To see if we have the space. Just make sure she hasn't had anything to eat beforehand. The food could react with the anesthesia and make her feel nauseous.
Okay, and you say it'll all be done within a couple of hours?
Yes.
What about after the procedure? My partner and the kids have got into a routine with Bubbles now. We each take turns to feed her and walk her. Can we just carry on with our normal routines?
Absolutely. The day after the surgery, she can eat normally. One thing I would say, though, you would need to limit her exercise for about a week after the surgery. I'd also keep her indoors for a little while.
Okay, so we just ease her back into the routine?
And to keep her indoors for a little while. But again, a very tough listening. Again, that is what Dr. BKM is all about, to be very truthful and honest to you rather than having the answers beforehand. I always try to take things the way you take it. So let's see how good and bad I have done. If you can help me with the answers, I would really be thankful. Yes, please, guys. Answers, please. Answers, please, guys. First is fine. 2 years, right? 2 years is fine.
Yes, sir.
And second one, pet displaying signs that she is in heat.
Yes, sir.
Is it correct? In heat? What does it mean?
Yes, sir.
Like
Yes.
she's pregnant or she's in heat? What does it mean?
Sir, in
In
heat.
And heat meaning? Okay. Preceding ovulation. Okay, cool. I didn't know about this word, so I should be honest to you. Okay, done. Third, trying to enter the fence or enter the hole. What's the answer? Enter the fence. We have taken the word answer as enter the fence. What's the answer?
Garden proof fence.
Well, the exact word was not given. I wanted to specify that place, but garden is also fine. I don't know whether she spoke about it or not. But there are so many words. Obviously, enter, if there would have been, again, that is the importance of preposition. If there would have been through word, so enter through the hole, then whole would have been answered. So yeah, enter the garden would have been better if I would have got this. But again, in exam, you will have the clear word that would be like enter word would be spoken, or there would be some synonym of enter, but it would not be like that altogether different words. So to enter the garden is fine. Yeah. Will consider dash to prevent hysterectomy.
Right.
Hysterectomy was the answer. Guys, did I mute you?
Yes.
Was the answer given? Abdominal surgery known as hysterectomy, that is what he said. Or is there any other answer?
So it's written spaying pet or bubbles to prevent pregnancy.
That is impossible to be written because he said three words. Spraying. What was this word? Spraying.
Spaying pet.
Spraying pet. But again, there was a second word that was abdominal surgery, and third word that was hysterectomy. So I could get only that word. So again, in the final exam, there would not be three answers. But yeah, I have picked up one, which is hysterectomy. According to medical, I should know about this term. Again, OET is not about spaying pet. My OET listening should be about medical. So hysterectomy should be the right word, but yes, we should know about the spelling of hysterectomy. So I'm just going to read the spelling for you. Hysterectomy. I hope my spellings are right. Hystrectomy. I missed out on E, but don't again try to please remember these spellings when you are practicing. Hysterectomy. Hystectomy. So please practice these spellings. Very, very important. Let's consider more.
Okay, I'll discuss it with my.
Let's go further. Let's go further. Let's go further. And so I will take the word hysterectomy as the main word. Consent procedure would hurt her.
Yes, sir.
Okay, so that was fine. A reduction of risk of that two words. Which were the two words? Infection and what was this word? Cancer, breast cancer. So breast cancer and womb infection.
Right, sir.
Cool. Advised about negative, like what was the negative thing? Decreased metabolism or slow down of mechanism.
Slowing of metabolism.
Slowing of metabolism. That's perfectly fine. Okay, cool. Requirement to eat less or feed less and maintain metabolism, or maintain one word we did. What was that word? Requirement to
Feed pet,
feed less. And
bubbles or her.
sorry.
So name of the pet is mentioned or her is mentioned instead of name.
It's impossible to fill again. I'm really sorry. Matlab, these kind of things will not. Requirement to dash and maintain bubbles. Requirement to feed less, feed bubble less, and maintain exercise.
Yes, sir. Exercise routine.
Exercise routine or exercise was fine. Obviously, maintain words should go with routine. A good thing to learn. Again, even from the listenings which are not good, you learn. So maintain exercise routine is better. Good. Owner willing to have procedures soon. Advise not to let pet eat before the surgery, right? Eat before the surgery.
Yes, sir.
And to dash for a little while. There was a word that he said, and that was also clear. And to
Limit her exercise
limit her exercise for a little while.
for a week.
For a week. But the word he said, I think, was little while. Again, I will make you
Tip 24.
listen again.
Week is mentioned, sir.
Okay.
Your time. It's a major decision.
Ease her back into the routine.
Right.
Okay.
Surgery. I'd also keep her indoors for a little while.
Okay. So we just ease her back into the routine?
Right. The day after the surgery, she can eat normally. One thing I would say, though, you would need to limit her exercise for about a week after the surgery.
For about
I'd also
for-
keep her indoors.
for about a week. That has clearly been spoken. So again, when I again, please don't take this lecture, whatever I have recorded, not for the sake of just doing it. Listening to it again and again still takes you to your subconscious mind that if we would be motivated, we will try again these kind of listenings. Again, if I would have tried again, maybe the last two blanks, I would have learned how to fill it. That is what makes me better. That is we did on that day as well. When we talked about that why it is important to do listening 3 times, because it improves you, it increases your efficiency. So please don't ignore this lecture. Even I'm not ignoring this. It's something to learn, like words like hysterectomy. A part can never be waste. You can always learn. You can learn the spellings. In heat is a new word for us. Spaying is a new word for us. So it's always good to learn. So don't take it for granted. Though this kind of tough listening, again, OET listening means medical word. Hysterectomy would be the final answer if it comes in exam. Spaying, that word will not be the answer. This is Dr. Bhupesh, again to guide you that we have to stay firm if we want to achieve anything in life. Thank you.